Pioneering breakthroughs in the health sciences continue to emerge across the University of Michigan. And because of the intense spirit of interdisciplinary collaboration at this university, these breakthroughs almost always involve teams of contributors across schools and colleges, across disciplines, and across the world with our many dedicated, talented partners in other countries. Tachi, Leslie, and the Yamada family are the founding donors of the Center for Global Health Equity at the University of Michigan. Tachi saw the University of Michigan as the best place to establish a Center for Global Health Equity. Because of the Michigan spirit of collaboration, because of our commitment to excellence, because of how we create and develop equitable partnerships, Tachi wanted the center here, and he wanted to challenge us to get better year after year at how we engage in the field of global health. Tachi insisted that this not be a center for global health, but a center for global health equity, with his deep conviction that our health should not be so influenced by the circumstances into which we are born.
The impact of climate change on human health is a critical issue for researchers in many disciplines. And it's a big issue in health equity because every negative outcome of climate change affects vulnerable communities and vulnerable countries unequally.
Around the world, access to clean and enough water is one of the biggest barriers to achieving equity in health of communities and individuals. I'm an epidemiologist, and it wasn't until I started working with the University of Michigan that I started collaborating with social scientists, including anthropologists, as Liz Roberts. This collaboration has expanded the impact of the work I do on environmental toxicants and human health. We are hoping that the multidisciplinary solutions that we are developing are going to improve water security around the world.
The COVID pandemic has brought into sharp relief what we refer to as wicked inequities in access to life-saving vaccines and other medical therapeutics. Health systems around the globe have come to realize we need more than just doctors, nurses, and epidemiologists, but also engineers, anthropologists, public policymakers, and social workers, among other diverse professionals, to address the challenges of vaccine production and delivery. We've done much at Michigan and elsewhere to develop effective vaccines and their subsequent rollout to populations in need. Building on that strong tradition, we're now designing interventions in the community that tackle vaccine uptake, access, and distribution in truly unique ways. We're excited how the University of Michigan, in partnership with international collaborators, is creating a new generation of novel strategies to ensure vaccine equity for everyone at every age, everywhere around the world.
Vaccine equity is not just about producing the next drug. It's the whole big picture of how we actually get those vaccines to communities around the world. There are local cultures and beliefs, supply chains and patent laws, and public policy decisions that often support or sometimes hinder response to disease outbreaks. All of these have to be taken into account because at the end of the day, all of these have a direct impact on human health.
30 years ago, Ghana had one of the highest maternal mortality rates in the world. Many of my Ghanaian colleagues grew up without mothers or were raised with their cousins because so many women died in childbirth. Since then, rates have dropped significantly, due in large part to an in-country training program for OBGYNs that the University of Michigan helped develop.
I was among the early beneficiaries of the Ghana-Michigan partnership to train OBGYNs. To date, the program has trained more than 250 OBGYNs, and we now have an OBGYN in every regional hospital in the country. Our partnership with Michigan over the years has expanded far beyond OBGYN, sparking other new training programs, important research collaborations, and ultimately, better health across Ghana.
Our collaboration with Aga Khan University is one of that, truly of that of reciprocal learning, where we have the opportunity to learn from each other about how we could use data for better health. Africa, Kenya has leapfrogged technology in terms of how we make financial transactions. And in the same way, with all that data they have in the financial sector, there are opportunities to also think through how we could use data for better health. Data has the potential to really change how we manage patients in today's world, where there's this tsunami and volume of data that's coming at us. Given this amount and volume of data, we need better data analytic methods to tease out patterns that potentially could improve someone's health.
One of the key needs is just a shortage in experts in certain fields. So there are really many parts of Kenya where people have to walk long distances to access healthcare. But actually, when they need to access certain healthcare, health facilities, then they're not even able to get specialized care. If you had so many images and you programmed that, can you come up with an algorithm that can identify which patients now need to be sent to a specialist? That would really reduce the time for diagnosis, because there are very few radiologists to read each scan separately. So I think there are very many settings in which, if we're able to use AI to really be able to cut down the wait time, the amount of time people are depending on the few health resources for identification, for care, I think that would be fabulous.
I think we're truly lucky to have Aga Khan University as our partner. It's a global university. Kenya, Uganda, Tanzania, Pakistan, Afghanistan. My understanding is that they see 7 million patients through their health system a year. I truly value this collaboration. It's an open, trusting relationship where we truly feel that we have this bidirectional learning that's all going on. And I think that's truly, the key to the success of this collaboration.
We want people to feel excited about the global health equity movement, not just at the University of Michigan, but everywhere that people feel restless to improve the circumstances around their health and the health of their community. We talk about a global health equity movement because this is about much more than academic research. It's about a mindset, how we approach everything we do. It's about a pathway of passion that helps us rethink how we go about academic research and its impact on communities. The movement is growing. More and more faculty from more and more disciplines are joining us. People are signing up to do hard work in hard-to-reach places, work that might not lead to the usual forms of academic recognition. This is by design. We want to elevate our global partners. We want to collaborate with communities around the world as they become healthier places to live. We want to help support future researchers who will make future discoveries of their own. As we engage in these projects, as we speak candidly with our partners, we see every day how significant the problems are and how many people are impacted by the work we have the privilege of supporting. There is still so much to be done. We need talent and expertise from every field, every sector, every community. If you're fired up about the movement, if you want to channel the energy and passion you have for global health equity, then please join us in this endeavor.